Hi, everyone. Thank you for joining us today. My name is Emily Ng, and I'm the program manager for the Executive Negotiation Project. Thank you for joining us today as we dive into topics around humanitarian engagement and local leadership in complex environments. We have a great panelist lineup for today. And so I just want to remind everyone to please submit any questions that you have throughout the presentations in the Q&A box. I will be monitoring those for submitting to the panelists when we get to the Q&A portion of today's event. I just want to thank you for joining us today, and I will transition to Neve Gibbons, who will be introducing our other moderator and also our featured speakers. Neve, over to you.
Sure, great. Thank you so much, Emily, and thank you everyone for joining us. And good morning from Boston, good afternoon or good evening to those joining us from other parts of the world. My name is Neve Gibbons. I'm with the Executive Negotiation Program at the Harvard Humanitarian Initiative, as Emily mentioned. The Executive Negotiation Program, or ENP as we call it, is a professional development program in humanitarian negotiation and engagement for humanitarian practitioners. We run a series of training workshops, both online and in various regional locations, called foundational frameworks in humanitarian negotiation. But we've also been running this webinar series because in the course of our workshops, we really get into a lot of really critical topics with the practitioners who are taking part. And so we want to be able to both discuss those topics with a broader audience and also gain input on those topics from other experts in the field who can really help us kind of build our programming and understand the state of the field on these issues. Today, we're very lucky to have three outstanding panelists, joining us, Landian Omam, Saba Al-Bumaslat, and Mazen Al-Husseini. Mazen will actually join us a little bit later in the hour, so I won't introduce him just yet. I'm also joined today by our colleague Enzo Bolletino, who is also at the Harvard Humanitarian Initiative and will be co-moderating the discussion with me. Enzo directs a program called Resilient Communities and also a training and professional development program called the National NGO Program on Humanitarian Leadership. So certainly has a lot of perspective on the issues we'll be discussing today. So to briefly introduce our speakers, first is Landian Omam. Landian has over a decade of experience in developing and managing public health interventions in complex conflict-affected communities. She's also currently undertaking her PhD at the University of Cambridge, where her research focuses on primary healthcare in conflict regions in Cameroon and Nigeria. Landian was also previously the Assistant Executive Director of Reach Out Cameroon, an NGO, and was the co-lead for the health cluster in the humanitarian response in Cameroon and Nigeria. We're also delighted to be joined by Saba Al-Bumaslat, who is currently the CEO of the Asfari Foundation in London, a grant-making foundation. Saba has a master's degree in education and strategic planning and an MBA in executive leadership and women in leadership from Oxford University and INSEAD. And she was previously the CEO of the Humanitarian Leadership Academy and led or participated in a number of humanitarian responses in complex emergencies regionally, primarily in the Middle East and North Africa. So we're really looking forward to hearing from our panelists, and I'm actually going to hand it over to Enzo now to get us started with the discussion.
Thank you so much, Neve and Emily, and welcome Landian and Saba. It's wonderful to see you again. We, of course, know one another through common interest in and participation in leadership programs that HHI has been involved in. I'd like to offer a couple of sort of framing questions for our conversation. Of course, we'll have very specific questions as well. But in terms of framing, thinking about some of the major challenges that the international humanitarian system has really been affected by in recent years. So most recently, of course, the pandemic, which really challenged any sort of ability to be able to be mobile and access populations in need. And more recently with the conflict in Ukraine displacing as many as 10 million people. And thinking about also some of the real challenges that climate change is beginning to present to the humanitarian system, and thinking through to the future, just how big a challenge that's going to be. So as a kind of first framing question, I'd like us to think about, is the international humanitarian system really prepared for these sorts of shifts? And is it simply a question of scaling up resources, or do we have to change the ways in which we work somehow? And then sort of related to that, a second framing question would be looking at localization and the process of localization, and trying to understand whether that can provide a kind of solution for some of the challenges that I just mentioned. So those are a couple of the framing questions I'd like us to consider as we're having this discussion going forward. But I've got a very specific question for Linda Ann. Linda, you've studied humanitarian health delivery programs. You've worked in Cameroon delivering aid through your work with Reach Out Cameroon. Can you tell us a little bit about your experience in that leadership role and whether you use various forms of negotiation and dialogue in terms of being able to negotiate access or to deal with security situations? How did you navigate the challenges that you found as you were delivering aid as part of your work with Reach Out Cameroon?
Thank you very much, Enzo and team, for inviting me to speak in today's webinar. I'm quite humbled to be able to share today's panel discussion with Sava and Mazim, who will be joining us shortly. I think negotiation and dialogue in humanitarian settings, especially in conflict-affected areas, processes which necessitates capacity building, but also requires sincere conversations between belligerents, funders, and communities themselves to be able to navigate the challenges which present themselves in complex humanitarian settings. And these are key important factors or determinants to the success of any intervention in a humanitarian setting. The need to have open and frank discussion with donors when the need arises is an important strategy of programming to ensure successes in service delivery, and to, of course, make sure that frontline workers are not put at risk and they carry out their operations under a safety environment. In a bid to try to force service delivery programs in complex settings, especially trying to please or trying to use a strategy which the donor enforces, literally means we're putting the lives of frontline workers at risk. And it could also meet with potential rejection at community level. An experience I had with my team and my colleagues while leading some NFI and food distribution programs in Cameroon was when the donor actually asked us to introduce, as part of our targeting process or targeting strategy, a biometric system of registration. We took on that approach and strategy of targeting and registering households to the community who at that time did not perceive this as an appropriate strategy, and this met with a very big rejection from the communities. We didn't try to force this strategy because it was the donor's exigency or the donor wanted us to use this strategy. We went back to the donor knowing that this could potentially lead to a very risky situation for frontline workers. We placed this at the table with the donor and had conversation around using alternative means of targeting. And thankfully, the donor was quite receptive, and we had to change the approach. we went back with an alternative approach that was more based on paper, using paper to register the household. And this was a strategy which we used for a very long time until when there was more acceptance of the organization and the interventions which we were implementing in the community. Then we began seeing some changes in the way communities perceive any form of electronic registration. Also, it is important to work closely with the communities and the community leader, because most often humanitarians might be tempted to literally just, in the process of mobilization, inform community mobilization, to just inform communities about what their plans are. And once they get an okay, it might be considered as it being safe for operations to be carried out. But then from our experience, we found that it is important to build trust in the community by involving them in the design and in the response itself. Getting them involved in activities like the mobilization process itself, also involving them in targeting, and also doing distribution for distribution programs. If we need people who would have to help in arranging the queue or doing other kind of activities which the communities have got capacity to contribute towards, we thought that it was very beneficial in gaining the trust and acceptance from community, especially in the context where initially when the crisis started, there was a lot of mistrust and a lot of skepticism around the neutrality and independence of the organization. So we needed to get communities highly involved in activities to build that trust, which really set us from having a lot of incidences, like risky incidences for frontline workers. So that aspect also is one which I would recommend humanitarian organizations actually consider very seriously when it comes to community engagement and being accountable to communities for the actions which we carry out. Lastly, I would want to speak to the fact that it is important to also train and build capacity internally with the frontline workers themselves around negotiations and dialogue. Because in many instances, we saw cases where the frontline workers themselves when faced with an incident, be it a kidnapping incident or abduction, they themselves led the process of negotiating their way out of that incident, and also in ensuring that they could have greater acceptance and access to allow for services to be delivered. So there are very many strategies which could be employed in such difficult contexts, and I'm very happy to speak to this as the program or the webinar unfolds. Thank you very much.
That's terrific, Lundy, and thank you for sharing that. You brought up some really interesting points there. Just a couple of quick follow-up questions. One, you mentioned the importance of engaging community early on, even at the design phase, and building and establishing trust with community members. So the donor had proposed a particular intervention, and through attempting to do that, they were fortunately open to revising and adapting their strategy. But were there lessons that came out of that they could utilize? So did they take those lessons in basically and adapt their policy to be able to make sure that as they're engaging local organizations, they've learned from the process that you basically led them through in terms of your own experience with Reach Out Cameroon? And then the second, not to overly complicate things, and hopefully you remember both of these. The second is, are there specific things that you would point to that are sort of essential training that staff operating in these environments have to have? Because you were speaking about them being able to, the people that were, the staff that were kidnapped negotiating on their own behalf to sort of try to get their release. Are there certain essential trainings that you would point to that staff really should have before engaging or operating in these environments? Over to you.
All right, thank you very much, Enzo, for those follow-up questions. I'd like to begin with the very last one of it, which has to do with essential trainings, which staff would, which organizations may want their staff to take. And some of those trainings could include trainings around safety in itself, like getting them to understand how do I say intuitive or proactive they should be in foreseeing potential dangers that may arise when they are in the community or when they are about delivering interventions, being able to develop risk assessment plans prior to each intervention, which could help inform them on the potential risks which may arise during service delivery, and so that mitigation strategies could be discussed within the group in itself. Also, training around humanitarian principles in themselves is very important, especially around the aspect of neutrality, because we were operating in the context where the narratives around the conflict, because of the conflict, people had different opinions, and we were very keen to ensure that the colleagues, our colleagues and the frontline workers, when delivering services in the community, wherever they found themselves in the community, it was very important for them not to get engaged in conversations around causes, around the conflict, who is right, who is wrong. So they really had to keep that neutral point of view and just deliver the services for which they were called for in the community, which is very important. Just thinking about it, I think those were quite key models which we included in the training package for our frontline workers, which really did help them while in the community. And the other question spoke to, I can't remember, I'm not quite sure, just to be certain.
Sure, Lindy, and you had mentioned engaging the community, excuse me, how important building trust was, and how the donor was adaptable. They listened to what you had to say, and I'm just wondering whether they took those lessons about community engagement and reaching out first into their own sort of learning and policy making, if you have any insight into that.
Yes, I believe they did take some lessons from that period of intervention with us, because in subsequent programming with us and also with colleague local organizations, they were, I would say, they were receptive to sit and listen to suggestions on how programs could be improved in our context, considering that most local organizations had been delivering development-oriented programs before the crisis came. So they were quite versed with the communities. And so when the crisis came, they could easily relate to some of the challenges which they were facing in the community. And when they came up with, when we all other local organizations brought up suggestions, subsequent suggestions to help improve on service delivery, they were quite receptive on that level in terms of trying to get the most out of how services are being delivered in the communities. Because at the end, we had one objective, we had one goal to reach out to the communities who were literally cut off from basic services and try to save lives as much as possible. Yeah.
Terrific. Thank you so much, Lindy Ann. Saba, I'll turn to you now. And you've had a tremendous amount of experience being involved in emergency response in the Middle East and in Africa. You were part of the founding of the Humanitarian Leadership Academy. Could you reflect on some of your experiences around the localization process begun under the Grand Bargain, and maybe reflect on what are the sort of essential elements, skills, training around humanitarian leadership, negotiation, et cetera, that are required to move that process forward, and just to share some of your basic reflections on that.
Of course. No, thank you very much for this opportunity, and listening to Lundy talk about the context that she's reflecting on, I can literally replace the name of her country with any other country I've been deployed to, and I'd be saying exactly the same thing, which means that, you know, it is so unfortunate that we sometimes silo our analysis of the challenges to the point where we think that we have a problem in a particular geography or a particular response. If we zoom out a bit and go and look at things from a macro level, we'll find that unfortunately, the sector has been repeating the same mistakes. So going back to your two, framing questions, are we fit for the future? I don't think we are. And I think a genuine review, bottom up, top down review need to happen. We all know that the international aid sector was born out of colonial history, and we need not to shy away from this ugly truth. We need to rethink, when was that sector established, for what reasons, what time, and how things have evolved dramatically since then. The number of problems and challenges, responses and crises around the world is mushrooming. We cannot respond to new crises in today's world using old tools, that's for sure. The second thing is that we cannot solve humanitarian crises with humanitarian responses. Sometimes it's very political. And while I know I'm not going to talk about the political aspects of it, but we need to politically commit to what we call localization. The reason I say that is, someone who co-chaired the localization work stream under the ground bargain for quite a long time, since 2017, when we met in Istanbul for the World Humanitarian Summit onward, it was really interesting to see that all international organizations, all donors, not a single, one out, managed to integrate the new vocabulary into their narrative. But the mindset with which they operate did not change dramatically. When we started talking about localization, we genuinely said we need to invest in building the resilience of local agents on the ground so that they can respond to crises as and when they happen immediately in a timely, effective, and efficient manner. But the trust wasn't there, something that Londi talked about a bit. There's still this struggle between letting go of the direct implementation by international organizations and this excuse, and I will say excuse, of lack of capacity at the local level to run their own show. When you ask a donor to define what's meant by capacity building, no one can give you a clear definition. So it's everything under the sky. And you would want a report card to tick. You want to say, okay, we've invested in ourselves for the past 10 years. We've done this much, we're good to go. What's really happening is that we continue to talk about capacity building, different training packages, different training agencies, but we don't see the end game. When would I be considered professional enough to be perceived as an equal, trusted partner to come and sit on the table and be part of the negotiation? That question is still not being answered. The second thing, when we talk about capacity building, it does not happen through training only. First of all, it needs to be financed. If you look at the RFAs and RFPs that are released by institutional donors, there's very little, if any, for core costs and for institutional and organizational capacity building. There are certain capacities that are project-based. So as if I'm investing in you to do my job for me, and that's it. But what happens after the grant comes to an end is your problem. What we want is the political and the financial will to build the resilience of civil society organizations, be it in development or humanitarianism, so that they can be the agents of change and they can respond to crises as and when they happen in their own context. There's a tug of war. I do understand that international organizations will be letting go of a huge business, and dare I say business. And the question is, instead of continuing to push back and say local organizations do not have their capacity in place yet, we need to, A, help international organizations redefine their role so that they remain fit for the future, and upskill local agents to be the ones who respond on the ground. What I've seen from the responses I've led, and I always worked for international organizations, is that we were so good in pushing risks down to local organizations, but never financed them well to build enough resilience to deal with such risks. And that is an unfair place to be. It's not the right place to be. If you ask me about capacity building, I'll ask the question back. What framework of capabilities would you set for any professional body a professional organization so that it can do its job right. It's everything from meal to finance to proposal writing to communication so negotiations become one of them. What makes negotiation quite critical is that the voice need to be heard, because you cannot negotiate on my behalf. So my voice, even if I'm not perceived as being professional yet, as a local partner, need to be present. I need to learn by doing, and you need to trust that when I'm responding to an emergency in my own context, this does not by default mean that I will be corrupt. I will care for my own people and forget about the rest, or I will be deceiving when I write my reports to you. So rebuilding trust is critical, and understanding and respecting that it is not only about deploying high-level globally fit standards, but about localizing and contextualizing the standards with which we run the programs on the ground, because different contexts have different specificities. Religion, traditions, norms, they change dramatically from one place to another. So a one size that is designed in Geneva or DC or London won't fit everywhere until our responses or our response approaches are contextually appropriate and designed jointly with people and respectful of the specificities of each community. Until we do that, our responses will not be done well. My last point is that from experience, working with mothers when they cross from a war zone to a refugee camp and seeing the pain and agony they are in, some of them would literally have lost their kids, everything that they worked so hard for, coming just as individuals, not knowing where they're landing or what's going to happen to them. The least we can do is make ourselves a little bit less bureaucratic and more human-centric, because at the end of the day, we can talk about the right design and the right structure, but if we forget that in the center of all of this, there's a human being, just like you and me, it is not their fault that they find themselves in a crisis. And we really need to think from where they stand. And we need to be humble enough to sometimes say, we don't know, and we're here to learn with you, from you, and together we can solve the crisis. So a human-centric approach to a contextualized solution in partnership with local partners, I think would be the way forward. And I'll stop here.
Thanks so much for sharing that, Saba. It really raises a number of issues, particularly around, we talk about in the training that we offer, the distinction between problems that are technical in nature, and for which a technical solution can be found, and those problems that are adaptive in nature, which really touch on people's values, their fears, their losses, their interests, culture, et cetera. And this idea around providing a sort of technical set of features related to localization isn't going to resolve the problems that are adaptive in nature, around really having a shift in mindset, building trust, and looking for ways that really enable local organizations to take the lead, and not coming up with sort of technical hurdles as a kind of excuse for actually providing a real shift in the way the aid system works. Can you point to any examples where you think this has sort of worked well, or where you've seen elements of trust building around localization? And are there ways in which local organizations should be should the training go in reverse for donors, saying like, or for international humanitarian organizations, saying this is what a good example of putting local organizations first looks like, and what can we learn from that process?
Yeah, I think it has to go both ways. So I wouldn't say that, it needs to go, from the south to the north and vice versa, because none of us on both ends, none of us know it all. So that's number one. Number two, I think the learning need to be intentional. For some time, I've been part of large projects or programs in humanitarian context, and you write endless reports, but the reports again are treated and read in a very siloed manner. A thorough and comprehensive review of what needs to change must happen. How can we co-create and co-design responses with people, and not during an emergency, but in preparation for emergency? I think we don't invest enough in upfront learnings that can really make us better prepared and ready for when emergencies hit. In most cases, I see that we are quite reactive. And because of the siloed approach to learning, in most of the times, we tend to repeat the same mistakes. I'll tell you, for example, I took part in responding to Iraq crises more than once, Yemen, Syria, South Lebanon, and Gaza. And I can tell you that we had reported back to certain UN agencies the exact same hurdles when it comes, for instance, to distribution of food and non-food items. We didn't learn. We repeated the exact same mistakes. So a practical example, you build this huge center for bread distribution in Zatari camp, one of the second largest camp worldwide for Syrian refugees in Jordan. And when we received the instructions, because you have to follow particular standards and particular approach to building that temporary distribution center, the same mistake was there. The manual did not include that we should have a separate entrance for men and women. And this wasn't our first emergency, and I remember writing and debating and discussing this with WFP, with UNHCR, name it, with all UN agencies, about the importance of taking into consideration certain cultural aspects or specificities as and when you design distribution centers. And we had to negotiate yet again. And that was my potentially 11th time having the exact same discussion about the importance of culturally appropriating the design so that it caters for the needs of this particular population. So the repetition of mistakes sometimes sends you signals that we're not learning. So a very firm and intentional approach to unlearn standard old ways of doing things and relearn with people, from people, what fit different contexts is definitely a necessity. It will save us money. It will help in building trust immediately, because when people sense that we are respectful of the cultural specificities of any particular population, I think that immediately helps in building trust. When they feel that we are imposing what we feel fit and not taking into consideration what suits their needs, that by itself challenges the concept of trust. So this is a very quick and very practical example that I had to live for 11 times, and still, I'm sure if I go back for another response, I'll be having the same discussion.
Thank you so much, Saba. We're very happy to be joined by Mazen Al-Husseini, who's now with us on the webinar. Mazen, we've been talking about the importance of localization and some of the challenges around it, both it being, there are some technical challenges, but often some of these technical challenges are a kind of veneer or excuse for more adaptive challenges and shifts that need to happen within the international humanitarian system to really prioritize local response and local organizations taking the lead in terms of preparing for and responding to emergencies. I'm going to turn to you now. You've held a number of senior positions in agencies working in the Syrian conflict. If you could reflect a bit on your experience with that work and maybe highlight some of the ways in which localization is or is not happening, and what the importance and relevance of localization is in really difficult conflict environments like Syria. Over to you.
Yeah, thanks so much, Enzo, and thanks for the committee as well. So particularly, I think within the Syrian context, local organizations were not really working smoothly in order to achieve the localization commitment. They were fighting, unfortunately, in order to gain that commitment. I think that's might be the same with other contexts as well. But I can remember back in 2013, because of the bureaucratic system of the UN, so it was not allowed for example, for WHO to ensure that there is vaccination that can be be delivered through non-governmental actors, even within the conflict which have crisis or conflict like Syria. So it took us, unfortunately, some time in order to go ahead and try to look at the modalities in order to ensure that local actors can have access to those vaccines. Unfortunately, that have led to a number of kids that were identified positive with polio until the UN system was really convinced with the importance of trying to reach non-governmental areas through those local organizations. And from that, I think the UN Security Council a resolution for the cross-border was gained a year later. So this is an example how local organizations fighting in order to have the empowerment, fighting in order to reach the local communities, and trying to look at solutions outside the bureaucracy of the UN and the INGO system.
Great, thank you so much, Mazen, and I'm glad you were able to join us. Yeah, so I mean, not a full switching gears, because you've all alluded to the shifting of risks to local partners and how local stakeholders need to have more of a voice present in negotiations and dialogue around humanitarian objectives. But I did want to just return to those themes just a little bit, and maybe Londiane, you could just jump in quickly. You know, managing risks and security is obviously central for kind of leadership roles within a humanitarian operation. But how can international actors really ensure that they're not just pushing the risk over to local partners? I think Saba mentioned that, but in your experience, you know, how have you seen this being managed?
Thank you very much. I think this is a very important and interesting question, which needs to be looked at by the International Humanitarian Committee, because from my experience, there are many practices that occur in humanitarian context that push all harm and risk on the shoulders of local organizations. I remember in many instances where we were responding to the crisis in those early years when the crisis just started, and that was a time when the belligerents actually were not very aware of humanitarian principles. This was very new concepts in the setting, and it wasn't very clear who is who, and this aspect of trust, again, at level of community, actually needed to be built over time. And we faced instances where some of our commodities got seized by non-state armed groups. And even after submitting losses reports to the donor asked the local organization, that's our organization, to pay for these losses. And I kept wondering, when a donor keeps putting the local organization in a situation where they are asked to repay or to pay for losses that occurred during an intervention, over an incident that the local organization actually couldn't control, I can't help but wonder where the funders think or imagine these local organizations will be getting this extra funding to repay for the losses, which for such losses. And I feel that this donor-grantee power relationship is a very important aspect, which would need a shared risk framework to help improve programming in communities, and also to ensure that the international agencies or the donors aren't just shifting the risk to the local organizations. And we have a couple of those examples where we sat and we felt the risk was actually being shifted to us, but we were at the point where in some instances, or in most instances, we had little control or choice over the decisions which were being made. And well, those are some of the realities which local organizations have to deal with on a regular basis when when international agencies and donors assume that semi-authoritative position in humanitarian response. Thank you.
Yeah, thank you, Landian. Those are such good points, and we hear from practitioners in our workshops all the time about, we talk so much about negotiating with non-state armed actors or with the state authority, but there's also a negotiation going on between, you know, you and your donors, your international partners, and as Saba mentioned earlier, you know, how do we make sure that the local stakeholders have a real voice and are really present in those discussions. And maybe I'll actually ask Saba if you'd be able to comment on that. So, you know, when the dilemmas that practitioners face when engaging with conflict parties, you know, seeking access, improving protection, trying to seek security guarantees, you know, how do you approach and kind of lead these engagements in a principled and kind of ethical way? Do you have thoughts on that? And if not, I'll kick it over to Mazen, because I think he has thoughts.
I mean, you negotiate. That's what we do, you know. So the fact that we're talking about, you know, negotiation, that's what we do. We negotiate, and we negotiate by walking a very thin line, remaining very true to our principles and values as aid workers, as humanitarian responders, but at the same time, understanding the reality on the ground. You know, when we were negotiating cross-border from Jordan, Lebanon, and the north of Syria to inside Syria, we had to engage with all sorts and types of, you know, groups, and I would keep it there without necessarily going into details. And, you know, those groups were fundamental to allowing us a secure access to people most in need. Because of the fact that we come from that region, we speak the language, we understand the mindset, we were able to hit the right sort of boxes and stick to talking points that are understandable by both us and those groups, but at the same time does not violate or go against the humanitarian principles. At the end of the day, if the humanitarian principles are not humane enough and do not allow you to save the lives, then I wonder what we're doing. You know, it is not rocket science, honestly. I mean, I worked in localization for quite some time. It's like, you know, if you want to translate this to action, there are few steps that you intentionally need to take. And I'll share a few of those with you. You know, you need to start by valuing the knowledge and the lived experience and expertise of actors in the Global South. People do know, and I promise you, being under siege in the middle of war in Gaza 3 times myself, or in South Lebanon in 2006, I do know that people know how to survive. Otherwise, they would have been gone by now. So that's number one. Number two, stop using your resources and influence to compete with local organizations. International organizations sometimes, directly or indirectly, are in competition with local organizations. We have that unspoken competition where we always say they do not know enough. We will go and do things for them. Trust me, they do know. So let's just give it a try. Use what resources and influence you have to ensure that donors increase direct funding opportunities to local organizations. They are not the ones who, pick the slack or do whatever you don't want to do. They are equal partners and they are trusted and should be therefore given access to direct funds. Ensure that any core grants you provide to local organizations from your unrestricted funds have limited reporting requirements. For goodness sake, during the Syria response, leading a regional response myself, I had 69 different grants by 69 different donors. Each donor had a different reporting requirements. And I literally had to projectize how people's lives were managed. But in reality, people don't live in projects. And for a local organization, if you really want them to do well, donors need to put the effort to mainstream their reporting requirements. I cannot have a team of 10 or 11 or 15 people working in a local organization having to do reporting for multiple donors in so many different ways, none of which is different from the other, to be honest. Trust that local organizations know where to prioritize spending. They do know that. They're not corrupt by default. Review and revise existing procurement conditions and conditionalities, trade-related backdoor agreements, because there's plenty of those, or programming that has been designed primarily or secondarily for, furthering, I'll say, donors' countries' business and security interests, because that's what we find ourselves stuck with most of the time, and exploit the existing power imbalance and racial hierarchies between the South and North. This needs to be addressed. The ugly truth must be discussed for us to overcome the hurdles and survive together. My last, what's in it for them? You'd ask me, why would donors have to go through all this trouble? Violence, terrorism, extremism, trouble are ideologies. They are not bound by their geography. They travel via internet. So if you really want to start investing in peace, you have to treat the world as one village and not siloed geographies where I say what happens in Ukraine stays in Ukraine or what happens in Syria stays in Syria. Nothing stays where it is. So there needs to be an intentionality with which we restructure a system that works for all of us and invests in peace and prosperity. Otherwise, there are no winners. I know I did not necessarily stick to your question, but I wanted to say that. I'm sorry.
That's quite all right, and I actually would like to give Mazen the chance to jump in. I mean, I know you you have just joined us a few minutes ago, and you have thoughts on this as well. And yeah, so I'll kind of throw the same question, but I'll also let you say what you want to say.
Yeah, particularly about the government, and then I'm going to move on about the role of about the INGOs and UN agencies. So particularly about government, unfortunately, the humanitarian interventions are not as easy as some might think about. Negotiation, it's not easy as well. So sometimes you have actors that you have to balance negotiation with. I've mentioned before my example about UN system, the bureaucracy in the UN system. Right now, I'm going to mention about the government bodies as well. So what if, for example, we were working in a context that the government is part of the perpetrators of violence? So how organizations should go ahead and ensure that their implementation is in harmony, their implementation is not causing any harm for the staff of the beneficiary. This is a dilemma, particularly within a context where the government do not respect the international humanitarian law. Then we will end up having, unfortunately, some of the cases where aid workers are being arrested, kidnapped, unfortunately killed in some cases. Like one of the reports CARE have launched in 2020, unfortunately, Syria ranks the deadliest place to an aid worker in 2020 for the 4th year in a row. And this is based upon statistics that they have, as well as from the platform of aid worker security website. So how can a local organization still respond to the needy of those that are under besieged areas or under airstrikes? We can have the same example in Ukraine right now. We have besieged cities and villages in Ukraine, and some of the parties of war, unfortunately, are using aid as a weapon to succeed their political views. So how we can ensure as humanitarian organizations, particularly those that are local, we are doing our best to reach those, and as well as to ensure that we are not breaching the humanitarian principles. This is a balance that unfortunately we fail to do because of the politician and because of the political atmosphere that we work with. Yeah, this is particularly about the negotiation with the government. Now about the INGOs. There is some of the INGOs that they have done their best actually with trying to transfer some of the power to local organizations. Myself, I have been part of the co-facilitation team for the measuring the ground bargain localization work stream, particularly in northwest Syria. I was representing local organizations in addition to some of the INGOs and donors as well. Each were representing their group. So we have seen that there is effort that was made by an organization here or UN agency there, but it's not a collaborative effort that at the end of the day, they are systematic in order to ensure that local organizations, when the UN agencies or INGOs do not have access anymore to that context, those local organizations are really empowered. So we are not talking here about a course of training that's done in order to ensure that the donors' rules and regulations, the compliance are understood of by local organizations. This will make them good implementers, but this is not a capacity building. Capacity building is beyond that. Capacity building is to ensure that there is a strategic, systematic capacity strengthening for those local organizations, sharing with them the indirect cost ratio, covering their administrative expenses, allowing them to use the funds in order to build their institutes by having policies, procedures, systems in place, linking them with donors, because if INGOs and UN agencies suddenly in Syria, for example, did not have the renewal for the cross-border resolution, is the whole humanitarian system going to collapse, or they are going to rely on those local organizations directly funded from donors? So we have seen some of the initiatives, but those initiatives are not systematic, and unfortunately the commitment from donors and INGOs are not strong enough, because during that deal, we can be easily hear that donors say, unfortunately, we do not have the capacity to manage a great number of grants with the small value of money. So why you have signed the grant bargain if you do not have the capacity to do this? This is frustration that I can deliver on behalf of local organizations. They are signing something and they are not committing to that something. So if it is just a tick or check list that you have made, no, you have failed with that. You have to make more efforts to ensure local actors are really empowered when you guys are living the country. Sorry for that. Over to you.
No, I think that's so true, Mazen, and it gets back to what we discussed earlier about more investment in anticipatory action. I mean, you like now when the crisis is already unfolding and people are trying to figure out how to just engage day to day and deliver the program or stay safe. Not necessarily the time when it's great to be really kind of doing that long-term capacity building and engagement and collaboration as you talked about. And the other thing that I would say, and I had the privilege of facilitating a workshop with Ukrainian practitioners just a few months ago. And I mean, they're incredible organizations and they really should be partnered with. They're extremely well established. And I think it's, seeing that response move forward, I think it would be important for international organizations moving in to really appreciate that capacity that already exists. So I think with that, I'm going to hand it over to Enzo. I think Enzo had one, we're really getting close to our time, which is incredible, but I'll hand it back. I think you had one last wrap-up question, is that right?
Yeah, it is. Thank you, Niamh. Really, thank you to all the panelists, Lundi, Saba, and Mazen. What a rich conversation, and I know that we could go on for much longer. Saba, one of the things that you mentioned really stood out to me, and that is we can't forget the sort of centrality of humanity. Not that there's a hierarchy of principles, but humanity is the why we do what we do. All the other principles are about how we do it to ensure that we're doing the why we do the right way. Lots of I hear a lot of challenges, but also some hope that there's the ability to move forward, and we know effectively what we have to do, and we just need to take steps and risks to make it happen. Acknowledging that there will be losses, but there will be far more gains than losses to be realized for the whole of humanity, for the entire world, if we can actually treat all of the organizations that are working on the ground toward humanity with equal purpose. I'd like to just ask one final question, that if there's sort of one sort of concrete lesson you can take out of the conversation about how to encourage that we all move towards this sort of commitment to localization and actually make it happen. What is the one sort of message you would want everyone to come away with? And you haven't had an opportunity to speak in the last few minutes, Lindy, so I'll come back to you and ask you to begin, and then to you, Saba, and we can close with Mazen.
Thank you very much, Enzo, for this question. I think, to me, one key lesson we could draw out of this conversation regarding localization is the fact that local organizations do have a voice in helping to inform and help direct how this localization process can actually be realized. But most often they are kept out of the decision-making table. And Saba raised it a while ago that it's not very clear when donors and countries will sign up for the grand bargain. Key definitions around what this is and what they were signing in for weren't made clear. The methodology in itself on how they were going to gradually move towards attaining this target wasn't clear. And in my own opinion, I feel moving forward, there's need to really bring up and involve local organizations in any processes, any policy making forum that has to do with defining key policies or resolutions around how the international community could potentially achieve what they signed up for in the grand bargain. So local organizations do have a voice, they have expertise, of course, which should not be undermined. And that voice does count and it does matter. Thank you.
Quickly, I think we need to action what we already know. I mean, none of what we're saying or have been saying for the past 10 years is new, but there need to be a will, there need to be a plan, and it needs to be financed, and change has to be on both ends, because changing part of the story would not tell the right story. So if we really care for better life for people, let's action what we're talking about. Otherwise, the very little hope that is remaining will be lost, and that is something we don't want. Thank you.
Quickly from my side, I think we have to change the mindset. Previously, 100 years ago, when INGOs and were formed, the core thing was in order to support those countries, third world countries, or those who were under the colonialist of the biggest countries. So right now, those countries are not anymore under the colony of the big countries. Those communities right now have the power. Those communities right now have the knowledge. They have organizations that we can rely on. We have to strengthen the local civil society. So localization is not a mainstream, shouldn't be. Localization should be the ultimate goal for the couple of years in order to ensure that we are not competing with each other. We are just allowing a system to be built in the southern region.
Thank you so much, all three of you. Thank you for joining us today. Thanks for participating in this dialogue. And thanks to everyone who attended. We hope that this webinar was as useful and stimulating for you as it certainly was for us. I think our panelists have given us a lot to think about, and we really appreciate everybody's time. Thank you.
Thanks, everyone.
Thank you, everyone.
Take care. Thank you.
Bye, everyone. Thanks so much.